Hi, this is Commissioner Melissa P. Dunn. Welcome to another community conversation. Now, I have been going out into the community, meeting with residents, meeting with HOAs, and really doing a deep dive in what concerns you about our city so that we may work collaboratively with staff to get them resolved, right? So, a while back, I had some conversations around specific issues that I would do on this live stream. It's been a minute since I've done one, but I really wanted to have this conversation today that we're about to have. Why? Because we are acknowledging Black Maternal Health Week. This is really a part of a broader vision that I have for a healthy, safe, and prosperous Lauderhill, where families and businesses thrive. And a part of that vision really led me to create the Lauderhill Healthy You tour, the Lauderhill Healthy You movement, creating conversations and opportunities for our residents to get access to healthcare, creating opportunities for you to access resources and for you to learn, and of course, for you to get connected. And so today we are going to be having a conversation focusing on Black maternal health. And for this discussion, I am going to welcome three amazing women who are in the trenches doing this work day in and day out. My first guest today is Amy Pont. She is a senior director of community health with over 35 years of experience. Now, Amy is a registered nurse and a U.S. Air Force veteran. She leads initiatives at Community Care Plan, including the Heart Community Resource Center. She is working to improve birth outcomes and expand access to care. Help me to welcome Amy to the conversation. Hey, Amy.
Hi, thank you so much for giving me this opportunity to have this conversation with all of you.
Wonderful. And next, my next guest is Dr. Harleen Hutchinson. Now, you might have heard me talk about the Babies and Bubbles brunch that I've gone to and participated in for the last couple of years. Well, Dr. Hutchinson is the one that puts on that movement. She is, in fact, a nationally recognized leader in infant and early childhood mental health. She is the executive director of the Journey Institute. Her work focuses on trauma informed care, maternal mental health, and strengthening families through relationship based approach. Hi, Dr. H. Welcome to the conversation. Dr. Hutchinson, okay, she can't hear me. We're definitely having some technical um, challenges. All right, well, perhaps Dr. H will have her back on at a future date so we can continue learning about her work. So instead, I'm going to bring to the stage another partner, a partner that actually is located right here in the city of Lauderhill, Dawn Liberta. She is the executive director of Healthy Mothers, Healthy Babies Coalition of Broward County, where they are leading efforts to improve maternal and infant health through education, advocacy, and community based support. I am so happy to have you join this conversation, Dawn. How are you?
I'm good. Thank you so much for having me. I think it's such an important conversation, and I'm glad we're having it.
All right, wonderful. Let me see if Dr. H has kind of resolved some of her. Are you hearing us now, Dr. H? No, she's still not hearing us. Okay. All right. So, ladies, I want you to kind of share with me why this conversation is important. I mean, for me, it's not just statistics, right? It's about our mothers, it's about our families, and it's about our future. So, why should we care about this issue?
Would you like to go, Amy, or would you like?
I guess, yeah, I'm happy to start. Um, So for me, you mentioned I was a nurse. So my background is actually maternal child, labor and delivery, postpartum, high risk, antepartum, pregnant women. So this has been my passion my entire career. And at community care plan, we do serve the Medicaid population. And one of the things that we really saw in our data was the disparity in outcomes for Black women in terms of really preterm birth, children in the NICU because of being born prematurely, and then having safety issues that could relate to infant death and that mortality. So it is a huge discussion that people need to be aware of, the disparity in outcomes for this community.
I mean, I'm part of that statistics, Amy. I actually, my son was born at 28 weeks, and he only lived for 31 days. So I know firsthand how critical this issue is. And I believe the statistics show that for Black women, they're 2 or 3 times more likely to die in birth.
3 times.
Yeah.
3 times more. Yeah. So how can we, help me to understand the picture. Like, why is this happening in Broward County and in Lauderhill? Dawn, what are you seeing? You're on the ground here in Lauderhill. What are you?
I think we're seeing a few things. I think that we have our moms and families, specifically our Black and Brown moms in underserved communities that aren't getting the support that is needed. They're not able to access the health care that is needed. Our Black moms are typically the moms to be getting late medical attention when pregnant. I think the community as a whole, it's our responsibility to ensure that we're putting services and resources in place so this is not happening, specifically when it's happening with one population of individuals at such a high rate difference.
Tell me a little bit about some of the numbers. What's the data showing, Amy? What are you seeing at community care plan?
I mean, we're seeing close to 45% when it comes to C-sections, which is another that contributes to poor outcomes and mortality and morbidity for the moms. So that's the first thing. And then right now in Broward, we're seeing about a 15% preterm birth rate, but that number is significantly higher when you look at the Black and Brown community. So that's like the overall rate, but when you compare it to the white community, the white community is like about 8%, and then it's around 15, or about 18 for the Black community. So you definitely see that disparity in why these women are giving birth, earlier. And I do think, we have a community resource center in Lauderdale Lakes, right on the border of Lauderhill. And so one of the things that we're really seeing when we talk to these moms, and Dawn mentioned about access, but it's all of the social needs that they have that are really impacting, transportation to get to those appointments, childcare to get, to watch the other children, not being able to have money to put food on the table. There's all those social needs that they have are causing stress, which also can impact preterm birth rate. So I think that's a lot of it for us is all those social needs that we're seeing.
All those social determinants of health. Yeah. Well, and when we think about the health of a community, right? Only 40% has anything to do with going to a doctor.
I say 20 so when I talk about it. Yep.
Yeah. The rest of it is your ability to have your basic needs met.
Yes.
Housing, transportation, great education, feeling safe in your neighborhood, feeling connected to your neighbors, having that support system. That's part of it. Now, in my case, in my story, I was at the time when I experienced my negative outcome, which is so clinical for me to say it that way. But, I had massive uterine fibroids. And I was diagnosed with fibroids. The only reason why I knew that I had fibroids is because I was pregnant. and the fibroids and the baby were fighting for space. And I literally spent maybe I would say 15 of the 28 weeks of my pregnancy in the hospital.
Wow.
And so imagine now a woman who didn't have the kind of insurance that I had,
Absolutely.
who didn't have access to transportation that I had.
Yep.
Or the support that you may have had or may not have had. Or, we see a lot of women that are pregnant that are not necessarily comfortable with advocating for themselves.
Yeah.
And so our moms to be need these advocates. For instance, we had a young adult who was pregnant and giving birth. Luckily, she was in one of our programs, so she had someone to call. The doctor wanted to give her a C-section, and when she asked why, no answer. They just wanted to do the C-section. So she called her support, our staff here, and they went and advocated for her. And there was no medical reason. There was no medical reason for that C-section. She was able to give birth vaginally, and mom and baby were safe. We know our bodies, right? And we need to be listened to. So the women in this community need to be heard.
And you bring up a really good point, Dawn, about support, right? So one of the things, we have a grant for the Heart Resource Center from the Health Foundation of South Florida. And part of that grant is with Healthy Start, and Healthy Start to provide doula training. So doulas are an area and I think that they're underutilized and people aren't aware of them. So something, Commissioner, that we could definitely help, because they can help advocate and help these women find a voice. And every Medicaid plan, not just mine, but every Medicaid plan provides access to doula services. And I think a lot of women don't know that or know the value of it. And that could be that support to help advocate. So that is one area that we can really, improve on and share with the community to get these women the support that they need.
Absolutely. Yeah, I love the doula program. In fact, if memory serves me right, 3 of my Lauderhill Shines graduates are actually trained doulas. That's there and ready to help. But explain to me, what does a doula do? And from a clinical perspective, what are their roles and responsibility, Amy?
So there's basically 3 types. There's the ones who do prenatal services, then there's the ones who actually come and help with the labor and delivery, and then there's your postpartum doulas. Some doulas do them all and some specialize. But from a prenatal perspective, they do home visits. They provide, education, for everything from healthy eating to, preparing for the baby, warning signs that they should be looking for. And then they will go with mom to an appointment if they need to, or to really help advocate for the woman, like in the example that Dawn gave, advocating, when they're in the labor and delivery for, why this mom can and should be able to have a vaginal birth. In the labor and delivery, they actually are like that support person, even if mom has a support person, dad, grandma, whoever, that they still, then mom, grandma, dad can really focus on mom and just, the comfort measures, while the doula kind of advocates and makes sure that everything is that the woman's being respected, that her birth plan wishes are being followed. And then the postpartum helps with things like lactation breastfeeding is very important for infant health. They'll help with lactation, help mom get some rest, baby care, all that but they really provide, from a clinical, they provide a lot of education, to really, so the woman feels empowered, but then they also help advocate.
Oh, I love that.
And can I add to Amy, we've been very lucky and we were able to get a doula that is certified in prenatal and post. And I think, there's a lack of education that is being given to our moms to be, how important it is that you're continuing to take care of your health even after you've given birth. The risk of preeclampsia after birth is much higher for women and their blood pressure, and it needs to continue to be monitored. And this is where we see a lot of the dangers in women is after they've given birth. And that education needs to get out into our communities more. And I think that there's definitely a lack of that education and those conversations.
That's
Right.
such a good point, because I mean, when you look at some of the health outcomes for our community, particularly 33311, 33309, and 33313, those zip codes, right, has a high incidence of diabetes and high blood pressure and some of these complications that really could make you have a high risk pregnancy.
Yes.
Yep.
We are seeing, I mean, and we're even having a lot of conversations, and Amy is part of a lot of the same committees that I am, and having conversations really about having those conversations with women about obesity and high blood pressure and diabetes prior to getting pregnant. So that way, women can be in the best shape they possibly can going into the pregnancy. But that takes prevention and a lot of education.
And that's a great point when you asked about statistics earlier. Here's our biggest problem. Only about 20% of our adult members go for a well visit.
Oh,
Right.
wow.
So because Dawn has a good point, which is interconception or preconception and intraconception between pregnancies is something we talk about. Dawn and I are both on the board of the Healthy Start Coalition here in Broward. And, that's something we talk about a lot is the fact that we need that care in between pregnancies and before pregnancy to deal with, like Dawn said, the high blood pressure, the obesity. And, these adults don't go for these well visits that, are no cost if you have any form of insurance. And then our safety net hospitals, if you don't have insurance, has programs to help people get that routine preventative care that they really need.
So it sounds like that's one concrete thing that we can do. Know your numbers, get your annual visit, and if you don't have insurance, find a federally qualified community health center. And we have two in Lauderhill, one at the Lauderhill Mall, the Broward Community Family Health Center, and then one on the campus of Florida Medical Center called Banyan Community Health. And so if you don't have insurance, or you need to be they can help you even see if you qualify for Medicaid or whatever kind of benefits you need. But the point is, not having insurance is no excuse for not getting your annual visit. So take yourself and a loved one to the doctor, people. I'm curious. How does tell me a little bit about your agency, Amy, and how you're helping in this work?
So Community Care Plan is a not-for-profit health plan that serves Medicaid, Florida Healthy Kids here in Broward County, as well as 18 other counties in Florida. But then, so for our membership, we do have our B3 program, Before Baby and Beyond, and we brought in the before because, again, the preconception. So all of our members get care management when they're pregnant, but Community Care Plan, our mission is to create healthier communities. And I always say, regardless of whether they're our member, even though I'd like them to be, or somebody else's member, or they don't have health insurance at all, because we are owned by Broward Health and Memorial Healthcare System, two safety net hospitals. But we also built the Heart Community Resource Center, which is a resource center in Lauderdale Lakes, right on the border of Lauderhill, that serves everybody in the community. And we co-locate with Broward Health, who runs a full service maternity center there. And that's really important because that community, your community, is considered a maternity desert. And so that's where we put in, Broward Health put in a full service maternity center in that center in Lauderdale Lakes so that there would be more access to GYN care as well as prenatal and postpartum care. And then the Heart Community Resource Center provides a lot of those wraparound services, everything from breastfeeding support to childbirth education, but then also things like financial literacy, because again, there's a lot of stress in our community right now about not being able to afford, their housing, or to be able to, get a better job, or buy food, put food on the table. So we have financial literacy classes and programs, job training for the partners or for mom when she's ready to get back in the community. And really important is we provide free childcare for anybody getting their maternity care at the center or taking a class, because childcare is another barrier that I really see in terms of people getting out to their appointments or to taking up these opportunities.
And the center is located at 441 and Oakland Park Boulevard, right? Right in that Dunkin' Donuts Plaza.
Yep, right by the DMV.
Okay, fantastic. Don, tell me a little bit about how your agency is working to be a part of the solution.
So Healthy Mothers, Healthy Babies has 6 programs. 5 of the 6 programs are specifically for pregnant and postpartum women. All of our programs go until at least age 1, some age 3. And it's health education, parenting education, nutrition, cooking classes. We have exercise classes, blood pressure monitoring, and I think people forget a lot about mental health when pregnant and postpartum. So mental health is included in maternal health. And so we do have a mental health program for depression, anxiety, and all of our programs start while you're pregnant and go up until the child is 1. We see a lot of deaths between birth and the age of 1, and our goal is to get these children past their first birthday. And like Amy said, we need our families to be stable as well. So we do have a program, which is all of Broward County, if you qualify, and that is to help with bus passes and gas cards or food, and electric and water bills. We're seeing a lot of families right now living outside of their car. Living inside their car, and just don't have stable housing. And so it is important that you are working with the family as a whole and not just resourcing one bit of that family. You really need help with the entire family in order for us to stabilize and make sure they have a bright future.
Yeah. Well, Dawn, I just like a month ago, I ended up calling you on a Saturday because I had a mom and like 4 or 5 kids in a car, ranging from toddler to like 8 years old. And you and your team came and opened up the office and provided services for them on a Saturday. So I want to thank you for really being in the trenches with this work.
Absolutely. That's what we're here for, and we want to make sure all of our families are safe.
So which is what, let's break it down to like the basics, right? What is the one thing that residents, families, or partners can do starting right now to have a positive impact on this issue? I'll start with you, Amy.
I was going to start with Dunn. No, just kidding. No. I would say, I think that the biggest thing is that we need to continue to have these conversations. People need to really, know that this is happening. We can't bury our heads and pretend that this is not an issue. It's a huge issue. So I think the first thing, like I always say too, when we talk about Healthy Start, is like all of our community leaders, all of our businesses need to be aware, because it takes a village. And so being aware of these statistics, being aware of the importance of getting care, getting early prenatal care. That's a huge challenge. Women coming in their 3rd trimester when they really should be getting care from the beginning. Really stressing that to the families, that care is important, and that postpartum care. A lot of women think, I already had the baby. I've had 2 kids. I don't need to go for that postpartum visit. I know the routine. But Dawn talked about the statistics around women dying in that first year due to high blood pressure or those things. So I think the biggest thing is just people need to be aware. People need to be having this conversation that getting care is really important to these women.
Yeah, keep the conversation going. What do you say, Dawn? What's the one thing?
Amy made great points, and I agree with all of them. I think that we need to realize as a community that it's all of our responsibility.
Yeah.
Just because it doesn't affect you doesn't mean that you shouldn't be helping with the solution, being educated, having those conversations and open to those conversations We can't bury our heads just because maybe we're past birthing age, right? It's all of our responsibility. And we all need to help, and we all need to support, and we all need to advocate.
Yeah. And I would go back to what we talked about at the top of this conversation, which is go to the doctor.
Yes.
Yes.
Regardless, every person in this community needs to go to the
Yes.
doctor. And, we're a city of small businesses, right? And sometimes small business owners can't necessarily afford to get insurance for themselves or offer insurance for their community, for their workers. And so this is what I say, find a health center. We have 2 in Lauderhill. Plus, I'm hearing that right across the street on 441 in Oakland, Broward Health has a location there that can provide GYN services, right? And it's not just for pregnant men, for pregnant women. It's if you are a woman and you need GYN care, you can go to that center.
Yep, absolutely.
So go to the doctor. Take yourself.
Go to the doctor.
Go to the doctor.
Yep. And I would say for pregnant women or postpartum women, your body. If something is wrong, you need to advocate for yourself that something doesn't feel right, because, it's easy to brush sometimes symptoms off, especially if implicit bias comes in, but your body. And if you feel something, you need to say it and get help to advocate for you if you need that.
Yes, absolutely.
Yeah. Well, thank you for that. Part of the reason why we're having this particular community conversation now is that we're celebrating Black Maternal Health Week. And yesterday I presented you and some other colleagues with a proclamation thanking you for the work that you do in our community. And I want to once again say thank you for everything that you've been doing, and what I know that you'll continue to do for our residents. I want you to go back and extend that thanks to your team.
Absolutely. Couldn't do it without them.
There's no I in team.
There's no I in team. Well, ladies, it's been an amazing conversation. Thank you so much for everything that you do.
Thank you again for having us.
So, Lauderhill, listen, this conversation does not need to end here, right? We need all of you, all of our residents, all of our business owners, all of our faith leaders and partners to come together around this issue. You heard our guests. It's important for us to continue to have conversations. Our Black women are dying unnecessarily at an alarmingly higher rate than other women around this issue of maternal health. I lost a child as a result. I've lost 2 babies as a result of this issue. So I am pleading with you, go to the doctor. If you don't have health insurance, find a community health center. If you are a woman and you don't have coverage, go visit the health center that Broward Health has. This is time for us to take our health in our own hands and for us to advocate for ourselves, because the truth is that we cannot have a healthy Lauderhill without a healthy you. It starts with you, it extends to your family, and then it extends to our entire community. So let's take care of our health, Lauderhill. Let's take care of our health. All right, everybody, I'll see you for the next community conversation. Be well. By the way, like and share and comment this video. Send this to our neighbors so that we can keep the conversation going. I'm Commissioner Melissa P. Dunn. See you for the next community conversation.